Welcome back. It's a Monday. Can you relate? We're glad you're staying with us. We're really halfway through October, and for many people, that means it's time to start thinking about health insurance for next year.
Yeah, open enrollment for Medicare just began on Friday.
Okay, and joining us to talk about this and then what people need to know is Sean Voskuhl with AARP. Sean, thank you so much for being with us this morning. How are you?
Good morning. Great. Happy Monday.
Happy Monday. Okay, we have a first question for you. Why is it important for folks that are looking into this to know about the changes in their coverage, or 2022 coverage?
Well, sure. Medicare is one of the most important health decisions you can make. So the enrollment process is very important to look at if you're first time to Medicare, or if you're looking to make changes to your current plan. It's really important to understand how the program works so you can make an informed decision. And really, your pocketbook will stand to gain. There's some savings out there for folks. Some people who've changed their Part D prescription drug benefit have seen almost $1,500 per year less by finding a more efficient plan for them. So it really pays to shop. If you're looking at a Medicare Advantage plan, it's important to make sure that you know your doctors in the plan's network. If not, you could be paying more through that way. But also make sure that if you're in a Medicare Advantage plan, or your Part D plan, make sure the prescription drug you're taking is considered a preferred medication. So that means you'll pay less out of pocket. And probably it's also important to look at copays to make sure that plans, there are differences in how much you pay in copays. And so there'll be changes in 2022. So you may want to examine your plan to make sure you're getting the best or lowest amount of copay that you can pay. And also check in with your local drugstore to make sure they're on the preferred pharmacy list, so you'll get cost savings to make sure they're preferred provider.
Yeah, and Sean, Medicare doesn't necessarily cover all healthcare costs for folks 65 and over. So are there resources out there for those who may have trouble paying for those healthcare bills?
No question. I love the Senior Health Insurance Counseling Program that's through the Oklahoma Insurance Department. They provide excellent counseling and unbiased information to help you compare prescription drug plans, whether it's traditional Medicare or a Medicare Advantage plan, also where you can save money with Part D premium plan as well. So visit that 1-800-763-2828, and they're great, and they've got great trained officials that can help walk you through that process.
I've helped some family members who've had to enroll. It's confusing if you're a first time enrolling, and I'm sure it's confusing if you're trying to re-enroll. And that kind of leads to scams, and people can fall prey to scams because a lot of this really can be confusing. So how do folks avoid being scammed in this process, Sean?
Well, unfortunately, Medicare open enrollment season also means Medicare fraud season. And so the main theme for scammers out there, they want to get your Medicare number. So whatever you do, do not share your Medicare information number, because what they want to do is get your number and sell it to other scammers, or they want to file a fraudulent claim. So just remember that a legitimate plan will not contact you. If you contact them, they'll call you back. So be aware of anyone trying to sell you a Medicare plan that's calling you, texting you at the mall, trying to sell you a plan. So we've got some excellent resources at the AARP Fraud Watch Network at aarp.org/fraudwatch network. And we have a helpline to help people walking through that process if you think you've been a victim of scam. And that phone number is 1-877-908-3360.
Sean Voskuhl, thanks so much. And we'll post this information as well over on the website. Important topic and important information there, Sean. Thank you.
Thank you.
We appreciate it very much.